Hi, I'm Dr. Young. I want to answer a really popular question of what is the difference between a mini facelift and a traditional facelift. Well, there are a number of different aspects that distinguishes between a mini and a traditional facelift. Now, in the media, there's a lot of different names that have been attributed to or assigned to a mini facelift, and that includes a short scar incision facelift, an S-lift, a quick lift. All those different lifts essentially are approximately the same, maybe done in a little different way. But essentially the difference between one of those mini lifts and a traditional lift include, number one, the length of the incision. The incision typically for a mini facelift entails making an incision in the hairline, along the ear behind this portion called the tragus, and along the earlobe, and sometimes it does entail an extension of the incision behind the ear and maybe along the hairline. However, once you start taking that incision along the hairline and making it longer, then you're starting to consider that this is more a traditional facelift. In addition, the depth of dissection is another aspect that separates or distinguishes the differences between a mini lift and a traditional lift. When the depth of dissection goes underneath the muscle, and the muscle that I'm talking about is the platysma muscle, which is essentially a fan-shaped muscle that starts in the base of the neck and goes into your face. That platysma muscle essentially is the same muscle that all facelifts pull on. A mini lift essentially uses sutures to pull up on that platysma, whereas a traditional lift tends to concentrate more on lifting that muscle by going underneath the muscle and restructuring that muscle. And hence, as you can probably guess already, the depth of the dissection with a traditional facelift is more aggressive, and it's a little bit more riskier. But in the hands of someone that does facelifts a lot, that risk is essentially almost the same. The other difference between a mini lift and a traditional facelift is that the incision is longer, again, and the other distinguishing characteristic between those two is that a mini lift limits the dissection underneath the skin to approximately 4 centimeters or 5 in front of the ear, whereas a traditional facelift tends to be more extensive, and the dissection can go towards the mouth and into the neck. Also, when you talk about a traditional facelift, you're more likely to consider other ancillary procedures that can accompany that a traditional facelift, including tying the muscle bands together here to improve the jawline and create a better jawline here, which you call the cervical mental angle, and that's called essentially a neck lift, and that really entails tightening up the platysma muscle in this area, as well as when you talk about traditional facelifts, you may entail extending the incision up here as well as including a brow lift. So those are some of the main elements that distinguishes a mini lift from a traditional facelift.